Good morning, Patricia. How are you?
Good morning, Rudy. I'm very well, thank you.
Excellent,
How
excellent.
are you?
Yeah, I'm good, I'm good. So, welcome to our community wellness dialogue,
Thank
and
you.
and our theme is what your community pharmacy can do for you.
Yes. Good
And
morning.
morning, and I'm so pleased that you're going to be able to speak to us today as it relates to fertility, pregnancy, and breastfeeding. And as a community pharmacist, um, first of all, tell us a bit about yourself and why you became a community pharmacist and where you're based.
So, thank you very much, Rudy, for inviting me here. It's a pleasure to actually be able to come onto this forum of community wellness dialogues to actually speak with yourself about such an important topic. Thank you very much for that opportunity. With regards to myself, my name is Patricia Ojo. I'm owner and manager of Stevens Pharmacy, which is based in New Eltham in Southeast London. It's a medium-sized, independently owned community pharmacy in the heart of the community in New Eltham here. As you well know, London is quite diverse, so I come within the borough of Greenwich. But I'm very, very close to the borough of Bexley as well. So I tend to serve community within two particular CCG areas, which is Greenwich and Bexley. Um, in terms of Stevens Pharmacy, I'm the owner here. I've worked in community pharmacy for a very long time. In fact, I worked out that I had a certificate from our Royal Pharmaceutical Society, which said I'd actually been a member for about 23 years, I think, and counting. But going back a little bit further to that, prior to becoming a pharmacist, I was actually a nurse, a registered nurse, and I very much liked patient and healthcare. So that's something that I did. And I had a brainwave while I was training that I actually wanted to become a pharmacist. Probably something to do with my background because my father actually ran or wholesaled within community pharmacy, etc. So that's where the interest came in medicines in particular.
Mm.
So I went on to train to become a pharmacist. And I remember my colleagues saying to me, they couldn't wait to see me in my community pharmacy one day. And of course, probably 21 years later, it did happen.
Yeah.
But I have had a journey in healthcare, which has basically involved working in acute in hospital care as a nurse, and then went out and did pharmacy and generally worked within community pharmacy. But there was something that I very much liked to do within community pharmacy was really bring the clinical aspect of what we do as community pharmacists within the community pharmacy setting, because I think very much that seemed to be the reserve of what was happening in hospital or maybe in general practice.
Yeah.
So in terms of the background, what I have done within community pharmacy was probably very novel because within community pharmacy setting, it was not very well known, but in Lewisham, I was one of the pharmacies which ran a community-based anticoagulation clinic, which I did for about 7 years. In that time, I actually facilitated a piloting of the service to housebound patients as well. And then that's now very well established and is going very strong. Although I'm not there, I have, previous colleagues who are running a very, very good service out there. So I've always been able to offer very clinical services within community pharmacy. On top of that, sort of done things like the NHS health checks where we're looking at cardiovascular risk of patients. We do emergency hormonal contraception, there was smoking cessation, and also minor ailments. So there's a lot that we've done within that. In New Eltham here, things are slightly different. We've not had all the services commissioned, but certainly we're offering the GP community pharmacy referral scheme, where we actually see patients for minor illnesses and then obviously, recommend products to them or refer them on for further assessment, etc.
Right.
So, yeah, this is my background in community pharmacy. Really has
Okay.
been really patient
Yeah.
care.
Yes, and it's quite extensive.
Yeah.
So, so the there's issues in terms of women's minds as it relates to the vaccine and fertility. So, can you provide some uh, reassurance
Yes.
about that?
So I think in the context and having spoken to a lot of colleagues, but also speaking to friends who are parents or are actually of childbearing age themselves, the main sort of themes that came out initially and probably still exist relate to the fear of the effect of the vaccination, either in affecting their fertility and the ability to actually conceive, or the effect of the vaccine that might then affect the pregnancy if they're already pregnant. And then we've got the other issue where there is the concern that they might then pass on the disease, the COVID sort of virus, because they've had the vaccine while pregnant. So there are a lot of concerns really. One of the most important things that I want to assure people is that with regards to the vaccine itself, it's now been administered quite extensively, and there's certainly research and a lot of work that has come out. And in America, I believe 147,000 pregnant women have had this vaccine, and there's certainly no evidence at all that it's harmful either to a pregnancy or it is harmful to a baby who's conceived when they've had the vaccine. Yeah. What we do know is that the disease, when it does, you do contract COVID, certainly in the final trimester, which is the last and the third trimester of your pregnancy, there is much more adverse effects on you and there's more higher risk of prematurity. So with regards to the risk and the benefits, there's much more detrimental effect of not having the vaccine than there is to actually having the vaccine when you're pregnant.
And breastfeeding?
And breastfeeding, again, there's the concern that people think that they might pass on the virus if they have the vaccine and then breastfeed. And what we know is that it's not passed through breast milk, and there is no effect at all on a baby because you're breastfeeding and you've had the vaccine. And in fact, what we do know is that when you've actually had the vaccine, as with another vaccines that you can have during pregnancy, which we know the whooping cough, for example, the rubella, you actually confer some level of immunity when you breastfeed and had the vaccine. So there is some protection you're giving to the child until they then get into the whole national immunization scheme where they start having their childhood vaccine. So there is actually a benefit to the baby from what we know.
And what about women undergoing IVF treatment?
Again, one of the things that we know is that there is no effect at all on your fertility and your IVF, okay? One of the things that we know is that certainly within the first, sort of stages of your pregnancy, that is the highest risk for other things. So sometimes people have considered actually we'll wait till we get past the first trimester and then have the vaccination. And there is no harm in doing that. We do not suggest that people delay IVF so that they can have their vaccine either, especially if you're on the borders of the age where the age affects your fertility. So women who are 37 years and over, we know that there can be a problem with your fertility in general. So if you are on the cusp of that age, should you be delaying your IVF treatment? No. And certainly if you're at a lower age range of that, then of course, then you can do what you need and there's no effects on your fertility. There's certainly a risk to you if you are further on in your pregnancy. And what we suggest for people to do, and people have often thought about this, is that they avoid the vaccine maybe in the first trimester, but certainly in the second trimester, they can have the vaccine and still have the time gap that is necessary to have their second dose, so they're fully covered by the time they enter into the final stages of the trimester, which is where we know that there is much more harm if you do contract COVID disease and you're pregnant. And there's the higher risk of premature birth in that stage if you do contract COVID disease.
Thanks for that. So are all pregnant women going to be offered the vaccine?
Right, so being pregnant in itself does not put you into a priority risk group.
Okay.
So people who are pregnant or of childbearing age will be recalled based on their clinical risk or their age. So if you are called for either of those, then yes, you just follow up through the process of when your recall is, but there isn't a particular risk because you're pregnant. So you're not going to be recalled as a priority group just because you're pregnant, if that makes sense.
And which type of vaccine is currently being offered to pregnant women?
Right. So what we know currently and what has been used very, sort of widely is the Pfizer vaccine and the Moderna vaccine, which are the mRNA vaccines. Those have been administered very, very widely, and the recommendation right now is to give those two vaccines for, COVID vaccination for people who are pregnant. There isn't any known risk at all of giving the AstraZeneca, particularly for COVID vaccination. However, because that's not been as widely studied, that's why that's not being recommended currently. But we do say that if you've had your first dose as an AstraZeneca one and you are pregnant, there is no harm at all in having your second dose as the AstraZeneca. So that's the only differentiator. So if you've not had the vaccine at all and you were going in first time to have it as a pregnant woman, you'll be offered the Pfizer or the Moderna vaccine. But if you were already, you've had your AstraZeneca, you're now pregnant, then because we only recommend that you have the same vaccine as you had the first dose, then the AstraZeneca will be an appropriate one to be given to you.
Right, thanks for that information. And Patricia, thank you very much from Stevens Pharmacy, New Eltham, South East London.
Thank you.
For being on what your community pharmacy can do for you.
Yes, and there's so much that we can do for the community, and so speak to your pharmacist. We're not only here to support you pre-conception, where you can get a lot of health care advice in maintaining good health, before you fall pregnant. Thinking, taking your folic acid pre-conception, but also we're here to support you to keep well in terms of maintaining good health. And also supporting with looking after younger children. So we have a lot of mothers and babies, but we also have the pregnant ones who still have young mothers and babies, and your community pharmacist is able to help you to actually look after your family and look after yourself to stay well, so you can actually look after them in probably the most demanding time of their lives as mothers.
Yeah, and maternal health, of course, is so important.
Very, very important indeed. And we know that our communities around us, do need a lot of support. And I think one of the things that you're going to get when you come to speak to, certainly myself and my colleagues in the community pharmacy, is that we will be able to let you understand what is a risk, what you can do. We can direct you to where you can go to actually seek appropriate help. And one of the things, key messages I would like to say is that early on, do seek pregnancy advice from your midwife. Engage as soon as you realize that you're pregnant. You must engage with those services so that you're within the system, so that you can get the support that you need, because we know lots of different things can happen when you are pregnant, and we particularly want to keep an eye. Talking specifically about Afro-Caribbean or people of Asian communities where diabetes type 2 is a very high risk, and we know that there is pregnancy-related gestational diabetes. That's something that we do not want to miss. So if you are having any symptoms or you have any concerns when you are pregnant, please speak to your pharmacist, because we'll be able to send you, or at least direct you to the right person to speak with, to make sure that you have your symptoms investigated.
And of course, you have a private consultation room, so people who have had advice and they're not sure, they can just walk in to the community pharmacy and somebody will sit down and go through with them. That's
right. I mean, every community pharmacy, and majority, and I certainly believe that within our area, 95% of pharmacies have actually got a private consultation room, and most of them are actually signposted as private, so that you don't need to actually ask. You can actually just go into the pharmacy, and if you say that you want to have a private word, there is a space that you'll be taken into where you can actually talk about what you need to discuss in the privacy of with yourself and your community pharmacist. So we do have that facility to do that.
Great. So Patricia, thank you very much and take care.
Thank you very much for inviting me, and have a nice day too, Rudy. Cheers. Take care. Bye-bye. Bye.